Good evening and welcome to On Call with the Prairie Doc. The aging process can bring many joys such as grandchildren, new hobbies, and more knowledge and experience, but it also brings on medical problems. 80% of older adults will battle at least one chronic condition or illness such as heart disorders, arthritis, or skin cancer, and 50% of older adults will battle at least two. Geriatrics is the branch of medicine that deals with the problems and diseases of old age. Tonight, we hope to answer your questions about the aging process. And to help us answer all of your questions, and I'm really hoping we get questions tonight, I am joined by Dr. Ellen Pinholt of the Regional Medical Clinic Aspen Center in Rapid City, and Dr. David Sandvik, who is the director of the Geriatrics Fellowship at the Sanford School of Medicine, USD, in Sioux Falls and Rapid City. We answer your questions as they are called in and or sent to us via Facebook or email, so get them in early. Call your questions at 1-888-376-6225 or send us an email. So today we have this cadre of geriatric specialists. Ellen Pinholt, tell us a little bit about you.
Oh, well, I started geriatrics in the late 70s, actually, and I grandfathered in geriatrics.
Without doing the fellowship.
In those days, the fellowship was just starting.
Right.
But you take the exams, and then I continued my exams throughout the time. And I ended up in the military, and a lot of people think the military doesn't have geriatric patients. But we do. We have retirees and sometimes dependents of active duty that end up needing our care. So I ended up eventually at the end of my career as the chief of geriatrics at Walter Reed. And then I retired and came to South Dakota.
So you're from where originally?
Watertown, South Dakota.
I knew that, you know. I met you when you were a pre-nursing student, right? Were you,
right.
And did you do your nursing?
No, I didn't complete it.
You did your pre-med.
I switched to pre-med.
And then you went to where?
USD School of Medicine, and then I did my residency in Honolulu, Hawaii at Tripler Army Medical Center. And
wow. And then did you go immediately into the, well, did you? Then you did geriatrics, how soon after that?
It was after my first 3 years in the military, and then I came back to San Antonio, and that's where I delved in geriatrics.
Great. And David, you're not only a geriatrician, you're the head of the fellowship program. Tell us a little bit about, where did you start, by the way?
In Colton. And I'm ending up there.
You're ending up in Colton, but you were a minister initially, or you did the ministry?
No.
What, you did some training in ministry?
I had a Rockefeller Theological Fellowship, and after college at St. Olaf in philosophy, went to Columbia University and Union Theological Seminary.
So you finished in the seminary?
No, I finished with a master's in literature and religion of the Bible, mostly Old Testament. So
that's very interesting. But and then after that, you taught?
I taught
grade school.
Well, middle school in the Bronx.
Did you know that?
No.
And for about 9 months, I was a New York City social worker in West Harlem.
I bet that was an experience.
It was very interesting. I remember being sent to a burned out building to protect my partner, a woman social worker, and found out later that it was the street in New York City where the most assaults on social workers had ever, and we were a biracial group at that point.
Yeah.
I thought, what have I gotten into?
And so you went into
medical
medicine.
school.
And you've been the head of the fellowship in geriatrics for 4 years or something like that?
Since 2010.
And this has been, geriatrics is kind of a dying fellowship, isn't it? I mean, it's been, no pun intended or any jokes or anything, but I mean, it's not been growing very well.
No,
it's been struggling to exist.
We've had decreasing numbers, and
and the major reasons are?
Well, I think the major reasons are that we haven't thought about it very well. If you look back, Ellen and I and you, Dr. Holm is also a geriatrician. He's a lapsed geriatrician.
I'm a lapsed.
I think we're having a...
I passed the boards, but then you're wanting me to...
Then you left.
I want you to take them and teach.
I know you do.
And I've talked to
Yeah.
people in the last month into retaking their boards.
Yes.
So we may see a resurgence. But during those years when you could grandfather in from the practice
Yes.
arm without a fellowship, we produced about 8,200
New
geriatricians. And from there on, the numbers have been going down because a fellowship was required.
And that's a 2-year experience?
It was a 2-year, and now it's a 1-year since about the first 2 years that they required a fellowship.
And we have 3 fellows now.
We have 3 fellows, and I think we need to turn back to those practicing physicians. We all took the exam because we wanted professional development, and we thought we could do a better job taking care of older people, right?
Yeah.
And that's exactly how practicing physicians still feel. So every time I bring this up to a group of practicing physicians and say we are offering a part-time fellowship if you want to keep practicing, they go, tell me about it.
So I thought, any comment about what he just
Well,
said?
I think we'll never have enough geriatricians anyway because of the aging of our
the
population.
boomers. The boomers.
Yeah, are going to overwhelm us. So I think just your idea of getting the physicians that are practicing primary care more skilled in the geriatric field is perfect.
Well, there's a great deal of special information you need to know to care for the very elderly.
Correctly. Yeah.
And I think the take home that I have on it is we use too many medicines, and we don't consider them, even when they have dementia, as valuable like we should. I mean, there's some things that you can learn as you care for people in nursing homes or helping keep people out of the nursing homes.
Yes.
And you know, the other part of doing geriatrics is that it's a different way of thinking. So let me give you an example. We have geriatric syndromes, and those are things that happen that you don't have a single medicine for, but people give single medicines for it. For example, I know this gentleman who was incontinent, and normally if he were to go to his primary care physician, he would get a drug for incontinence, something to help him hold urine. And it turned out that he had been an engineer, and his daughter wanted him always to look professional, so she made him wear button-up pants, Levi's, khakis, and he couldn't unzip or undo his trousers, so he was always incontinent. And finally, her sibling,
button-up, sir.
the daughter's sibling, and it was really a problem of
Communication, not drugs.
yeah. And
Drugs is not the answer.
so the other
observing.
siblings finally talked her into allowing sweatpants, and his incontinence
Went
improved
away.
by 40%. So
and
we think about those things.
Very quickly, what age group is geriatrics? At age 60, 65, 75? When do we start calling it? Do we have an age?
Oh, I think 65, but you know, more it's complexity.
It's more, yeah.
Yeah, well,
And actually, it's getting more towards 75. Don't you think?
Oh, I think so because, well, I won't
'Cause
tell
we're
you
getting
exactly
closer.
why I think that.
I bet I understand. In 1969, Bob Bartling and other Brookings community members started a running club to emphasize the importance of physical fitness.
We had elements from all over Brookings, meaning we had high school athletes, we had college athletes, we had coaches at both levels, and we had just citizens at different age levels. And so there were 10, 12 of us at the initial meeting, and we organized the club. And of course, the club has prospered. We had different goals with our club, and one of them early on was to increase our membership, to incorporate more people in the community, to join our club and to also reap the harvest from our club by jogging as the main purpose for acquiring a new fitness level. We had very, very few turndowns. And looking up the old minutes in our newsletters, we reached a high of over 900 members. But our mission, our goal mission of the club was the promotion of running for purposes of fitness and health. I got down to 4 minutes and 52 seconds, but that number, the first number is the important number, 4, see. In other words, you could always tell somebody I could break 5 minutes. You didn't tell them by just a little bit, see. And now I'm at a level of 15 to 20 miles a week. So again, you could extrapolate and get your yearly mileage, and it'd be pathetic. If I can hit 900 miles or 1,000 miles a year, why, I'll be perfectly happy. My favorite is a golf course. In other words, a soft surface to land on. And then from there, I like to go gravel, because that's next softer. Then blacktop, and then cement is the last resort. And you see the beauty of jogging is you can do it anywhere at any time with hardly any equipment. You've got to come up with what you enjoy doing and what you'll stick with doing. And that's the key to this whole thing. And if it isn't jogging, it can be walking in that area. But you take swimming and you take biking, and they're terrific. So you can come out with the end result of being fit with any of body's movement.
Well, Bob Bartling has been a friend of ours for a long time, and what a joy to have him on our show. And you know, I think what happened, and he and I think it was Scotty Roberts, a doctor from Brookings who's now passed away. Scotty Roberts and Bob Bartling and another, I think, or two. I might not be Scotty, but I think so. Started up this running club, and then they couldn't get shoes, so Bob put a shoe store in the basement of his furniture store, and then he'd sell them at cost to get people. And when you bought shoes, you get a reduction in the price if you join the running club, which is what got me in the running club. And now I'm a permanent member because that was my 50th birthday present from my wife. And so anyway, I just have to say thank you to Bob Bartling, a perfect example of a regular exercise program. Now, I'm crazy about exercise. I think it's very, very important. I try to run about 20 miles a week. I'm not in Bob's age bracket, but I think it's very, very important. What is your take on it, Ellen?
Well, I think that's very commendable, but I want to say to all the people out there that it doesn't have to be that committed. It really can be as simple, and we can use the term physical activity.
Let's not say exercise because people don't like that word.
Right.
So physical activity.
And that just means you can walk, you certainly can walk, you can do stationary bicycling, swimming.
Yeah.
All very good. And then, should I put my pitch in?
Yes, let's hear your pitch.
And then, from the National Institute of Health, there's a free exercise guide and activity.
Physical activity
yes.
guide.
And what's great is it has ordinary people doing chair exercises and such to help with balance, to prevent falls. I think that's where we're most committed to physical activities to help prevent falls and get better balance.
But isn't that true? The stronger you are, the less you fall. I mean, isn't it
Yes.
that's the main exercise? It's strengthening. I mean, is an ideal exercise, Dave? What's the ideal exercise?
I think it's just staying active. There was this book, The Blue Zones.
Yeah, let's hear that.
Where a researcher from National Geographic, and I'm blacking on his name right now, but took a blue pen and made marks on the world map for where each person living over 100 centenarian lived. And the areas that turned blue he called blue zones. We have one in the United States, it's Loma Linda, California, where the Seventh-day Adventists live, and they have a pretty strict diet. But those people had no gyms. I mean, we're talking about.
We're not talking gyms, are we? We're
Right.
talking activity.
Yeah, we're talking about Costa Rica, an island off the coast of Italy, but remote areas. And the main activity that they did was to raise their own food and gardening.
So it was raising your own food that really kept them best.
Probably on both ends. The
Right,
activity
eating
then
right and
eating.
exercising right. Yeah. Well, I know that we have longevity in
In South Dakota, absolutely.
Aren't we? I thought we were the
We're like-
epicenter right here.
We
for,
are near.
Actually,
It used to be.
What happened was that we are a state with some of the highest percentage of elderly, but in large part it's because people have moved out.
The denomination.
Yeah, the younger people left.
So we've got a lot of older people. I'm not sure that we're actually the longest lived. That's in Loma Linda.
Okay. But and is it their diet or is it their activity?
Yeah.
There we go. So we have a question. A 60-year-old man from western South Dakota. How does grape juice and other antioxidants slow down the aging process, Ellen? You think grape juice has anything to do with it?
I don't think that's really known. It's certainly popular to take antioxidants and certainly fresh fruit, you know, they do blueberries and things like that. I mean, certainly fresh fruits are always good, but I don't think taking antioxidants, certainly in a pill form, is necessarily known.
And other antioxidants.
It has been studied. The pills have been studied and
Didn't
never
make any
found
difference.
any
Yeah.
difference, but the foods with those
Right.
vitamins in are
Have made a difference.
Yes.
I think there's, in the woman study, something like 30,000 strong, for over 10 years or longer than that, they found that people who drank a certain amount of alcohol, not too much,
Small, yeah.
lived longer. And I do know that they found when they were studying mice that that vitamin E or that the antioxidant issue was real, and they saw that vitamin E was in there, and they figured it was the thing, and all of a sudden all the researchers were taking vitamin E, and the big research, including you, and when it all came down, there was no difference.
Right.
And actually, there was a difference. There was like 1 out of every 350 people who took more than the daily requirement of vitamin E who died of cardiac disease.
Yeah. And it's the same thing with calcium. I mean, there's some cardiac disease with too much calcium. So let me ask you both, is there any particular vitamin or supplement that you recommend, Ellen?
No,
No.
not particularly. I mean, I end up, if they aren't eating a regular diet or have troubles, I sometimes just do the multiple one a day with calcium and vitamin D. Certainly in South Dakota, we do have a lot of vitamin D deficiency during
We
the
don't have
winter,
enough sun.
in the sunlight during the winter months. So I think supplementing that, but not over
Right.
supplementing.
Yeah, I take a vitamin E. I mean,
D.
not an E, a D.
D.
I do 2,000, particularly the winter, the two seasons that are less sun than night. Dave, do you take any supplement?
No, I don't. And I think if you have a reasonable diet, you don't need a supplement. Now, there's one exception, and that's if you are in an institution, either assisted living or nursing homes. Then everybody should just be diagnosed as being osteoporotic, and you should be on calcium and vitamin D to decrease the number of falls and fractures.
And activity.
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 There we go.
That's right.
All right. Only 4% of people over 65 years of age are in nursing homes. 4%, which means the rest either live in their own home or move in with a family member. Lucy Kephart recently moved her mother into her home and allowed us to come in and find out what the transition has been like.
And I kind of noticed starting in November that she began to sound kind of more anxious and when I would call her, and worried and more pessimistic, which was not like she normally was. Ordinarily, my mom is the queen of optimism and has a wonderful sunny disposition and always has been very, very optimistic. But that kind of changed in November, and I worried about her, and so I called her more frequently, and she was hospitalized just for a brief period of time, and I went down to check on her after that. And it was apparent to me that, you know, she just kind of needed more help and support than she was getting living on her own. You know, we didn't know if it would be a long-term stay or a short-term stay. Mom wasn't really...
And I moved in.
Yeah, she wasn't really ready to move in and stay with me, and that wasn't our initial plan. Our initial plan was come visit for a while, see how you are, get your health back, see how things are going, and then we'll kind of make decisions as we need to. We had the plan starting years and years ago that if my mom ever needed more help and wasn't able to be independent, that she would come to wherever I lived. Mm-hmm. Not necessarily move in our house with us as it happened, but she would come to my town. And so it made sense that she would come up here at that time. You have a companion that comes 2 afternoons a week.
And she's my walker.
And she walks with you in addition to the exercise group. Mm-hmm. So I found some planned activities, you know, some services that we have available in Brookings, a senior citizen center, and then also a paid service to have some in-home companionship. So that helps. My mom has said that that's one of the things that she's been aware of that's been more challenging, and it's certainly one of the things that I've seen in geriatric care too, is I need to, you know, help make sure that my mom keeps her meds straight, that she takes them every morning, takes them every evening, so I'm cognizant of that. I come home at lunch and check and make sure, you know, morning meds are gone, and in the evening meds are gone. All throughout my life, she's been my mom, I've been her kid, and we've had that role. And that has shifted a lot. She'll often refer to me as mother, in a joking way, of course. But I think that's one of the ways that we are successful in our relationship now, is she's been able to understand that, you know, because of how her memory is right now, there are certain things she needs help with, and I'm here to help her. And so she's willing to let me make decisions and do things for her.
Now, weren't those two beautiful ladies to provide that for us? Thank you very much, Lucy and Lucy's mom, for sharing that information. You know, we talk about assisted living and nursing home. When is it the right time, or maybe better yet, to just move in with the kids? I think the old way was that you would move in with your children, or they would bring you, or they would move in with you.
Historically.
What's happened, and what do you think the future brings, Dave?
Boy, that's a big question.
Is there any support for families taking care of their elderly?
I think there is. It's a really good reason to have long-term care insurance. And if you do get long-term care insurance, you should make sure that you get something that covers home care and maybe care by relatives. As well as institutional care. But there are times when you should go into a nursing home.
When is that?
If you get hospitalized and very weak from whatever reason that you went in, and need to have some strengthening, some rehabilitation before you can go home or to a different level of care. If you are unable to do 3 hours a day of therapy, you can't go into a rehab hospital, rehabilitation hospital, freestanding one. So you need to go to the nursing home. That's your ticket home. Now you should be in charge of what happens to you and say, my goal here is to get home and it's your job to get me there.
Yep.
That's my doctor, my therapist, my
Yep,
social worker, my
exactly.
nurse, everybody who's a team member here. Your job is to get me back home.
Right. Now, I mean, that's nursing home options, and that's not exactly the reason for some of them, but for many of them. After a fractured hip, I get them to the nursing home. What about the assisted living? Ellen, why not the assisted living? What's the difference between assisted living and a nursing home?
Well, a nursing home, like Dave was saying, is skilled care. So you have skilled therapists, physical therapists, nutritionists, things like that. And nursing, you need wound care or incisional care, or you need a lot more one-on-one care. Assisted living sometimes just ends up being, a step that when you can't get socialization at home, when you can't do your chores, your daily chores at home, and you just can't complete them, or you use so much energy doing your day-to-day activities that you don't get to go have fun with your card-playing friends, because the daily living chores just weigh you down. And sometimes that's actually a time where you can say, maybe I should go to a senior community or an assisted living.
Right.
Because then you have support and you get to enjoy company. And your relatives, when they come to visit, are more visiting instead of, making sure you went to the doctor's office, you got your shopping done, you got your cooking done.
It's a relief of a burden. I think there's a lot of fear of assisted living and nursing homes by all of us because I don't want, because they're all demented in a nursing home, which is not true, and I just don't want to get demented, and therefore I don't want to go to the nursing home. I mean, I think that's the false idea that
And
people.
the last thing, if you are over age 65 or any age, the last thing you should do is make your children promise they will never send you to a nursing
That's the
home.
worst thing to do.
Because you may get to a point, my parents both got to the point where there was no way that we could take care of them at home.
Why not go to that 5-star hotel and let them take care of you a little bit? So let's move on to some questions. My dad is 65. Should he stay with his family doc or go to a geriatric specialist?
We have a mythical beast in South Dakota called the jackalope, which
Yes.
is a mixture between a jackrabbit and an antelope.
Yes? They're real though, aren't they?
And mostly you see them in
Wall drug.
in taxidermy situations.
Yes.
And it's almost easier to find a live jackalope
Than it
than a
is.
geriatrician. in South Dakota.
So stick with your primary care doc.
Yes, but there are times when you should see them. For example, every physician should ask their patients if they've fallen once or twice in the last year. And if you've fallen twice or more, and you are living independently in the community, there are many things that can be done to decrease your chance of falling again. But it includes therapy, it includes evaluation of your medical situation and your medications, and that should be done by a geriatrician.
All right. A question for Sandvik. 68-year-old woman would like to know if there's an alternative for amitriptyline since it diminishes sex drive. Sex drive is an important part of anybody, any age, or at least from 18 or 14 or whatever it is up to a certain age. Does it go away for everybody when you get old? What's the story on that, and what should we do? Ellen?
Oh, you said it was a question for him.
Well, we'll put that question to you, Dave.
Okay.
Amitriptyline. We're talking about a medication.
I don't want to embarrass any of the younger people in the room here, but sexuality remains important all through life for many people, and for many people it remains unimportant.
From the beginning to the end.
Yeah, it probably doesn't change an awful lot throughout life. But amitriptyline is an antidepressant. It's an older antidepressant. And it has a lot of side effects. If I were on it right now, I wouldn't probably be talking like this because my mouth would be
so
very dry, and I might be dizzy when I stand up, and I might not be able to urinate, and a number of things.
Mostly people are switching to nortriptyline and very low doses, right?
Nortriptyline is a better older drug and very inexpensive, but there are other newer antidepressants also that are good.
But I don't
But-
ever
but-
use it for depression. I use low doses for chronic pain. And
It may be that this is for chronic pain. That's mostly where you see it. You don't usually see people using it for depression. But any of the antidepressants can have effects on sexuality.
Right. That's in fact, almost every drug seems to do that. Blood pressure medicines, letting the diabetes run amok, though, is another story that can cause trouble with sexuality. Smoking is a big thing that people don't talk about enough. Ellen, tell us more about geriatrics and sexual issues.
I don't.
Viagra. I mean, have you?
Well, I mean, we do have a lot more help for people, and I don't know if geriatrics is always so involved. I have to say urology tends to be more involved at times, and gynecology remains important. But I think people also have to just wonder what their take is and what do they really mean by it. Certainly just closeness is sometimes all that people really want.
I had an 87, 88-year-old lady who was dying of a cancer, and she was in her bed, the room. I wasn't caring for her. This was years ago. And she said, "It's the most amazing thing that ever happened to me, Rick. I got to tell you this story." And she said, and I had a college student shadowing me, this young, kind of petite girl. And she said, "It's amazing. I met this friend at this dance thing that we were doing, and I decided to cook supper for him. And so he came over for supper, and we had supper, and then we took off our clothes and just held each other. And of course, it wasn't working for him. He was 90, and but we tried, and we just had a wonderful time. It was just amazing. And the next week, he came over for Sunday dinner. And the same thing happened the third week, the same, and then he died." And I went,
If she dies, she dies.
he died last week, and we had just did that. It was just amazing. It was so wonderful. I'm just so happy about it. I just wanted to tell you this. And I'm like, 2 weeks later, she died.
Oh.
And I thought to myself, wasn't that a joyous story? But that girl standing in the room, her mouth, bah.
Yeah, let me say that if you are having sexual issues, you really ought to discuss it with your doctor. People are afraid to bring those sorts of things up, but postmenopausally, a lot of women have difficulty with sexual performance. So do men. Men have got a medicine for it. There's not a great solution for women, but you ought to talk to your doctor.
And you look at the drugs that you're on.
Yes.
The drugs for dryness of urine killed the sex. The urine flow drugs for prostate, many of them kill.
Right.
So, Ellen.
Oh, I was going to add though, but what's interesting is the fastest rate of HIV is in the elderly population, because
Viagra and the like.
well, and because they think, well, of course I'm not going to get pregnant, so they don't think about sexually transmitted diseases, and it was quite astounding when that statistic started coming out.
Right.
That
Well, it's also interesting. We were talking at noon conference a couple of days ago in the fellowship about gynecologic issues, and the recommendation is that women have had Pap smears, I think, for 4 times every 3 years apart. You don't need to continue them, but a lot of people get to Medicare. Women get to Medicare, and they get their first Pap smear, and you find
a cancer that's
a number of cervical cancers. But then you're faced with the question of, should I do pelvic exams and Pap smears? And what I've told women is that, and I think you can take this home too, that if you have had new sexual partners, you should have Pap smears again.
Yep.
Those 3 or 4 Pap smears every 3 years.
And now we're not talking just 65 or older. We're talking 40s and 50s and 60s and all
along.
all of them.
And you tell me whether I need to do a Pap smear.
Yeah.
You don't need to tell me details. Just tell me whether I need to do a Pap smear.
Yeah. Ellen?
Oh, I was going to say, I mean, Pap smears during the 40s still continue to be
Yeah.
a recommendation.
Right.
So,
Yes.
yeah.
As we grow older, our tastes and desires change when it comes to diet. However, there are always better choices when we plan our daily menus.
The best menu for boosting memory and brain function encourages good blood flow to the brain, much like what you'd eat to nourish and protect your heart. A recent study found that the Mediterranean diet helps in keeping aging brains sharp. Strengthen your recall by adding these foods to your diet rotation. Eat your veggies. Eating at least 1 or 2 servings at each meal of colorful, crunchy vegetables, especially from the cruciferous group, will help you get plenty of these in your diet. The more color in your vegetable selections, the more antioxidants and nutrients for you. Be sweet on berries and cherries. Berries, especially dark ones, are a rich source of anthocyanins and other flavonoids that can boost memory function. Get adequate omega-3 fatty acids. Essential for brain health, these may help improve your memory in healthy young adults. Seafood, algae, and fatty fish are some of the best sources of omega-3 fatty acids. Work in walnuts. Walnuts not only have a positive impact on heart health, but also can help to improve memory. Add a handful to your day for a mid-afternoon snack.
Welcome back. The question we talked about earlier was which supplement should we take? And again, we all three of us totally agree. The best supplement is food, right food, balanced food.
Balance.
Give me ice cream
Okay.
when I need a supplement.
So we've got some questions. This one is about supplements. Feel free to. The 68-year-old woman from Rapid had a hip and knee fracture in the past 4 years. She doesn't have osteoporosis. Would the experts recommend calcium and vitamin D supplements?
I think by definition, she does have osteoporosis.
It depends on how she fractured.
Right.
And why is she falling? I mean, that's the other thing.
If she fractured when she fell, but if she fractured with very little stress, she by definition does have osteoporosis, and then it's up to somebody to decide what to do.
You know, I check vitamin D levels before I start people on them, but I almost, if they don't want that, then I'll just start them on it. And but I'm reluctant about the calcium with the vitamin D, but you guys probably feel differently. What do you think? Ellen?
I think you need both because of the vitamin D has to have calcium,
But
enough calcium in the diet to work.
Right, and that's it. If you've got the D, though, and you're eating a balanced diet, or
Well,
even
if
close.
you have enough calcium, yeah.
Yeah. Dave, you have any comments about that?
You know, you might want to go with a different medicine than jumping to calcium and vitamin D. You might want to go to something that more aims at preventing fractures.
Oh,
Or the
true.
Fosamax and those things.
bisphosphonates.
Yeah, so that you really need to talk to your doctor about that. But you should be screened for osteoporosis. Again, almost by definition, you probably have it.
Okay. Tell me about the idea of feeding tubes in demented people. That's a question that I have, and I want to ask my folks. My prompter just went out, so you need to give me another source of questions. Go ahead. What about the idea of feeding tubes in
Well,
the...
funny you should ask.
Yeah.
We just happen to have these sheets of paper here about choosing wisely, which is something that the American Board of Medical Specialties has been doing over the last few years. So there are now 10 things to think about if they're recommended to you. 10 things from the American Geriatrics Society and 10 things from the Society for Post-Acute and Long-Term Care Medicine. There were 5 of each of those that came out a few years ago. And in both of them, there's don't recommend percutaneous feeding tubes in patients with advanced dementia.
Try to feed them, they say. Just try to
Instead,
feed
try
them.
to feed them. And as I say, give me ice cream.
Well, it's much more, to his point, yeah, it's much more enjoyable to the person to have something in their mouth. And although it might not be enough, but at least it's the human interaction, it's the taste, and if they liked ice cream before, give them ice cream.
So are you starving them to death?
Oh, and that was, the ethical issues in the past, thinking that we need to give them food and water. But actually, when people with dementia, their brain is getting smaller and they're shutting down, and they don't get hungry and thirsty, as if I stopped you from eating.
No, so I think we don't put feeding tubes hardly at all in this community. We really believe in. If they're in severe dementia, you don't deny them food. You put them up to their lips, but if they don't take and can't eat and drink, then the question is to the family: do you want us to force feed them? And they don't do well.
Well, let me read what the recommendation was here. Careful hand feeding for patients with severe dementia is at least as good as tube feeding for the outcomes of death, aspiration pneumonia, functional status, and patient comfort. Food is the preferred nutrient, and tube feeding is associated with agitation, increased use of physical and chemical restraints, and worsening pressure ulcers, and as I recall, also pneumonias. So you aren't doing anything good, and you're doing a lot of things that are not so good.
Harmful.
Yeah, I think this list was fabulous, and the issue of sleeping pills, it talked about avoiding lipid-lowering drugs when you're older than 60, because the data doesn't say that it supports.
I think it's older than that, probably, when they're less than 10 years of expected lifespan.
Life expectancy.
Anti-psychiatric drugs, we talked about that, blood pressure medicines, diabetes medicines, stop cancer screening. There's a time you quit these things.
And there's one big one that occurs on both these lists also, and that is don't give antibiotics for urinary tract infection if you don't have any symptoms of a urine problem.
If you did a urinalysis on every nursing home lady that I have in my nursing homes, they're going to all be abnormal.
About half of them will be positive. So they go into the emergency room for a sore elbow, and they get treated for a urinary tract infection.
Which gives them vaginitis, C. difficile, diarrhea, all sorts of problems.
Resistant bacteria.
There's a caller that asked, where can you get the exercise book you promoted, Ellen? What is the?
It's the National Institute on Aging, and the website has GO, the number 4, and then life, and then .org.
Go4life.org. Go letter number 4.
Life.
Life.
And it has a DVD or a CD or a book, and it's awesome.
How much is it?
It's free.
Oh, so
It's your taxpayer dollars.
taxpayer dollars being used. That's great. That's good.
Great.
We're a 60-year-old from Pierre. What kind of respite care is there for caregivers? See, caregivers.
That's a very good
That's an important issue. I mean, what happens when we are burned out by caring for our elderly family member? Dave, any comment about
Yeah,
respite?
actually there's provision for that, and you can call the Office of Adult Services and Aging in the Department of Social Services in South Dakota, and there are monies to have the person that
care.
you're giving care to in daycare or maybe a nursing home stay.
Right.
So there are some possibilities there.
Right. So respite, you can put them in for a day, kind of a thing. Come up, pick them up at night. Those
I
types
had a
of
friend who every 2 days every week he was able to put his wife in a care daycare,
or nursing home
and,
daycares.
then he could
Go to the grocery store.
have his own personal time.
Yeah. A 71-year-old woman from Sioux Falls would like to address supplements. Is there such a thing as taking too much? We're going to do a supplement show, and I want to say that and prepare the audience that supplement show will be coming up in May, and it's going to be really interesting. And my answer is yes. And I think the big study that sticks in my mind is that 30,000 woman study, and they looked at the 10 years and the women that were taking a multivitamin versus the women who were not taking a multivitamin. There was no difference in groups. I think there's a
And
danger.
we've
in some-
certainly seen milk alkali syndrome in people who took too much calcium in the days before we had anything else to treat ulcers.
Right. 84-year-old from Brookings feels extremely tired. She eats well. Would a probiotic capsule help with digestion? I kind of like probiotics, but they can be spendy. Any comments, Ellen?
I guess you had that on your show last week, right?
Yeah.
Yeah. I don't know if it helps energy per se, but certainly helps digestion.
I heard a presentation yesterday, and the very careful studies have not shown any differences in outcomes.
No. So we've got some questions that we're going to answer later on the computer. What would be your most important take-home message, Dave, that you would want people to make sure to remember?
Oh boy.
Any comment about making sure that you go to the doctor if you've got dementia? Dementia would be one particular topic.
And dementia we haven't touched too much on. It's very, very difficult. I'd say you probably somewhere along the line should see somebody who specializes in not memory problems, but thinking problems. Much of the time, people who have those problems know them themselves. But we have the fellowship clinic, actually, that you could contact, and we could do evaluations on people with early memory problems, but also neurologists and psychiatrists.
Well, in your general primary care.
And your general primary care.
You need the CAT scan probably one time, and then you need thyroid and B12 levels for sure, and a general workup.
So we just put in a grant to train primary care and geriatrics, and we sent out a survey to clients of the Alzheimer's Association in South Dakota, and 40% of them said they did not find well-trained professionals to help them. So it's difficult.
We need to have
more
some training to take care of the elderly. Ellen, what would be your most important thing? There's a book that you're recommending.
Oh.
Aging Well.
Yeah, aging well. I think we tend to do kind of doom and gloom for aging, but actually there's successful aging. And the lessons in the book by Dr. Valiant was on the Harvard longitudinal study, Aging Well. And he mostly emphasized that it's not the bad things that happen to us, it's the good things, good people that come along and happen to us. It's a gratitude journal. It's forgiveness from past experiences. I mean, it's trying to show people that although you have a lot of losses along the way of your friends, you have to gather new friends. And that's why sometimes moving to assisted living, for instance, you end up becoming friends with the aides that help you. You end up becoming friends with your table mate. I think it's a process where you add to your group instead of keep subtracting as you age.
And speaking of aging well, your mom and dad are doing great, and I'd love to say a shout out to your mom and dad. I knew them very well.
At Stony Brook.
We'll be right back after this.
Ready to quit? Great! We're ready to help. Call the Quit line to set up a quit date. Takes about 15 minutes. Next time we talk, we'll review free medications, triggers, coping, withdrawal. Takes about 30 minutes. Check in for 2 more support calls and we'll go over challenges, how to handle slips. And don't worry, if you're stressed or things get rough, just call. Then, bam, you're tobacco free. So take a deep breath. You can do this.
Baby boomers are coming of age, retirement age that is, and many are wondering what's going to happen. Starting about 9 months after soldiers returned home from World War II, there was a birth rate boom coming almost as a celebration of soldier survival. And this has profoundly affected our culture. Baby boomers, and I'm one of them, are those born from 1946 to 1964 during a successful post-war economy. This very large group of kids were the most privileged of all time. Often raised with a soldier-disciplined father and a not always happy work-at-home mother, we grew up watching too much TV, listening on transistor radios to Beach Boys and Beatles, and facing a new and real threat of atomic warfare. Still, life was quite idyllic for boomers during those first 18 years. But after graduating from easy and perfect boomer high, we were slapped into reality by the draft, Vietnam, and a newly realized inequality happening between sexes and races. This generation, often labeled as one of sex, drugs, and rock and roll, grew into an angry, government-distrusting counterculture that fought for social justice, for causes like feminism, civil rights, and the Vietnam War. These all reflect the boomer ethic, the right of self-direction. Well, it's no surprise this group has also achieved the most wealth. Accounting for 24% of the total U.S. population, boomers hold on to something like 80% of our country's wealth, account for 80% of all leisure travel, and dole out 50% of consumer spending. 76 million boomers in the U.S. are a huge cultural demographic. Like a pig swallowed by a python, the big bump is moving through the snake and is now coming to retirement age. As we become very elderly, sick, and disabled, there will be a smaller cadre of youth to care for us. Will we become a huge societal burden? First of all, the elderly are usually not that burdensome. Research finds 75% of those aged 85 or older still drive. 70% are not depressed, 60% do not experience significant memory loss, and on average, the elderly is as happy as any age group. When boomers turn 85, although potentially a demanding group, I predict we will find the resources to care for those who need it, and some might still be active enough to even physically help. More importantly, most boomers will have an advanced directive, bypassing futile efforts and reducing the risk for a prolonged, expensive, and painful death. And in these next years, as boomers have more time on their hands, expect intolerance to social injustice and an increasing demand for the privilege of self-direction. Well, this brings us to the end of our show this evening. For more than 35 years of caring for older people, I have heard it said many times and believe it's true. Growing old is not for sissies. Life can be tough. But I know that the ones growing old with grace are those who stay active and interested with a sense of blessing and humor. May we all strive to do it that way. I sincerely thank our fantastic guests tonight, Dr. Ellen Pinholt and Dr. David Sandvik. Thank you so much. And from all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
Allergies are when your immune system reacts to things in the environment that most people tolerate easily. We scratch the surface of allergies. Next time on Call with the Prairie Doc.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
Additional funding is provided by
Aberdeen Asthma and Allergy,
Brookings Health System,
Dakota Allergy and Asthma,
Dakota Care,
Dakota Dermatology,
the Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
and Swiftel Communications.
Closed captioning for On Call with the Prairie Doc is provided by the generous support of
Avera
Brookings Health System
and Fishback Financial Corporation.
Flying through. Thank you. Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we thank you for them. And now we're going to try to answer them. So let's just get started. Quick answers. 76-year-old woman from Sioux Falls would like to talk about her retirement communities. She comments that they're wonderful places to be with many physical and social activities. I agree. It sounds like a dear friend of mine from D. Smith, where I grew up. She is now in a retirement community. I think she's having a great time. What are your comments?
I think we all just say ditto.
Yeah,
that's it.
That's more socialization.
So socialization is very important. They say, okay, to prevent dementia, the most important brain exercise is not puzzles, it's conversation. Have you heard of that? No.
I haven't heard of it to prevent, but for depression, well-being and state of depression, you need to be able to talk in person to one or two people a day.
Every day.
Yeah.
It struck me while we were on the air too that when you were Ellen, were talking about assisted living in nursing homes, there are times when people go into them and their family has to start making appointments to see them.
Yeah.
You know?
Because
there's a lot
busy.
going on. They aren't
so
that
busy.
bad.
No.
If you need to be there.
85-year-old woman from Sheridan, Wyoming with type 2 diabetes has a constant central tremor. She has gotten vertigo about 3 times recently. Is there a relationship between the diabetes, the central tremor, and the vertigo? What do you think?
I don't know.
Nothing comes really quickly to mind.
I think not. I think the central tremor is a benign tremor. It's not Parkinson's disease. The diabetes, that you get that in non-diabetic and diabetics. Yeah. And then the vertigo. I don't know of any connection.
I don't know for sure. You can have, mononeuropathies, but I don't know about.
And you can also have very benign vertigo. And
the
worse it is,
issue.
probably the
more benign.
The more benign it is. If you get your head in the right position and things start to whirl. You sit up in bed and things start to whirl. If you
Roll
change
over in bed.
position
Yeah,
and
position.
it starts to whirl, then there are things you can do to train yourself to not have that happen. It's usually a piece of calcium or debris that lays up against the hair cells in your inner ear and causes you to think that you're in a different position than your eyes are telling you where you're in, and then your brain fights and you start to whirl.
Trying to figure out what's going on.
Right.
It's sort of like being in a sailboat in the
And
ocean.
you can see an occupational therapist and train yourself to ignore that.
Or go sailing. A 53-year-old woman from Rapid. Why is morphine the drug of choice for pain in the emergency room and hospital, and what are the dangers? Well, that's an interesting topic. How about narcotics in the elderly?
Well, they're quite problematic in most elderly.
Constipation really
right,
hits
right.
big time.
But of course, we also are mandated to treat pain, so we end up with a dichotomy of not ignoring pain, but going to morphine first is not a usual standard.
Yeah, I've stopped using morphine. Yeah. I use either fentanyl or Dilaudid IV if you need to do an IV narcotic.
There's a lot of concern about narcotics because it's a big problem. I can't remember who said how many people are using illegal narcotics in South Dakota.
It's just, yeah, it was we did a show on it. There's a huge number of, and what they're doing is they're coming in, they're getting their pain medicines, they're going out and selling it because it's making their money
but what should happen is that you should first find out why the pain is happening, and then find out if there's a more appropriate and a shorter time frame to treat.
Right. Perfect answer. 60-year-old from Pierre, what kind of respite care is there for caregivers? We answered that. Caller has high iodine. What can she do about it? I've not ever found high iodine. Have you?
I wonder why it was measured.
I don't know either.
I wonder if you
But
can.
we do know that if you have low iodine, then if you're a baby, you can get cretinism, and if you're an adult, you can have a goiter. Right. And there are parts of the country that have not enough iodine in the food, and that's why we have it in the salt. Except that some people are not putting it in their salt, but too much iodine?
I would wonder if it might have been measured by someone who's not in the traditional medical field.
Right. But
like
I don't
hair or something like that.
Right. I'm not aware of any major disease from too much iodine. Well, there is, but unless you're taking huge supplements.
There's a poison sign if you remember those old iodine bottles.
Yeah, right. There's too much.
Who drinks it?
Yeah, where would you be getting iodine? Except maybe supplements. Actually, there is an issue about some supplements having too much iodine, but I've never measured a level.
No.
What is the expert's impression of Prolia for osteoporosis?
I guess it's one of the bisphosphonates.
No, that's that shot twice a year, isn't it? Yeah.
Can you?
Prolia. Ellen, you know there's the.
It's a different mechanism.
It's a different mechanism.
It's a hormonal intervention, I think. I'm not all that clear on it, but
pass on that question. But
except that
you're not prescribing a lot of it, obviously, are you?
It works. It was released, and it's for people who have problems with
I think it affects the.
And whatnot.
Yeah, it fits.
Isn't
it's part of the parathyroid.
It blocks osteoclasts from eating up the something like that. I have not prescribed it yet, but I do believe that there's a time and place for it. But you really want to make absolutely sure that there isn't a vitamin D deficiency, there isn't a calcium deficiency, there isn't some kind of hormonal problem that's causing this.
I've used it in nursing home patients who really could not tolerate anything orally.
64-year-old man from Alcester. Is there any correlation with prostate issues and lack of sexual interaction? In other words, if you don't use it, you lose it. What do you think?
I don't think, well, prostatitis.
I see exactly how that was.
Well,
Or-
here's the issue. I'm pretty sure as a guy who takes
Okay,
care of a lot of old
Go
guys,
with it, yeah.
and the answer is, if you're not being sexually active, you can't jump back into it and expect it to work. I do think that there's a time to check testosterone if someone is interested in sexual activity,
Right.
but there's some danger to it.
And the question
but
is,
the prostate by itself, I don't.
and the question is, what kind of sexual interaction is the lack of sexual interaction? So if it really is an erectile dysfunction, we've got medicines for that. It's usually not associated with prostate problem, it's more with vascular problems. But if on the other hand it's lack of sexual desires and whatnot, then testosterone checking and other things is appropriate.
Right. Anything about sexual function in women, older women, Ellen?
Well, I mean, it's more. They've been advertising more directly to people about the painful intercourse with the vaginal atrophy. Yeah.
Yeah, lubrication
Yeah.
medicines.
But as far as desire, I don't know. They don't tend to give women.
Desire medicines.
Yeah.
There certainly has not been as much.
You can do that, but.
Yeah, there's not been as much study as
Right.
in male sexual dysfunction.
No. 84-year-old from Sioux Falls, how do you control the pain of arthritis? That's the million-dollar question, isn't it?
It is.
I would say the most important thing to do is to get them moving. Bone on bone, people do better.
Yeah.
It has to do with
activity.
activity.
And you can use local treatments. Capsaicin, I think, works pretty well.
Which is
hot pepper cream.
Hot pepper. And there's topical Feldene.
Have you used a lot of that topical Feldene?
Some. Mm-hmm.
Yeah. With success?
Yeah. But as far as going beyond the nonsteroidals is always like we're always kind of wary depending on how old the person is.
And even utilizing the nonsteroidal, you have to be careful. But
yeah, because of renal function.
the knee is special because there have been studies that show walking improves knee pain. Walking, two non-pharmacologic interventions are walking and losing 5 pounds of weight. Study after study has shown that those interventions are good, helpful.
There it is, a non-medicinal therapy.
Right.
Where can you get the exercise book? We said that. We are finished with our questions. I thank you both very much for
Time for
joining
wine?
us. Time for a break afterwards.
Is that on TV?
Yeah. Thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. And until next time, stay healthy out there, people. And announce that we're going to go have a glass of wine.
Yeah, thanks, Dave. Yeah, it's like
I thought it was funny.
It's all right. We said it was all right.
Yeah.